Health Department presentation. Geographic location, socialization, and genetics are just a few of the determining factors of health. In order to understand how communities deal with health, we must first understand the surrounding factors that affect the health of the world's population. Epidemiology, which provides a methodological foundation for the public health field, is unique because it focuses on the health population, as well as it differs from clinical medicine's involvement with individual patients. A wealthy community has the resources to educate its population on prevention of disease and treat them when they do arise, whereas a poor community does not. For example, in the United States, there are a plethora of hospitals and doctors, as well as research and medications available to treat a community. In a third world country, the likelihood of being able to be treated for a disease is dramatically lower. Where a person lives, as far as their community is concerned, plays a vital role in their health. Minute details such as a city versus country living have a large effect on health populations. Socioeconomic factors are made up by where a person comes from, how they were raised, and how much money they earn. Someone that was raised in a metropolitan area will be more likely than someone that lives in the country to run to the nearest Walgreens upon the onset of a cough. The available resources have conditioned this person that medications are accessible with ease. Improving health is a prominent initiative. Decreasing the gap between those who enjoy access to good health care and those who struggle significantly is definitely on the national agenda. Issues in low-income housing affect the health of its residents. Lead paint, asbestos, and pesticides are just a few of the potential hazards that affect those that live there. There is especially a prevalence of asthma in children that live in low-income housing. The burden of asthma falls disproportionately on those that live in high urban areas characterized by high levels of poverty and minority populations. As one of the core functions of public health, the assessment process includes the concept of community diagnosis, surveillance, identifying needs, analyzing problem causes, collecting and interpreting data, case finding, looking at and forecasting trends, research and evaluation of outcomes. In order to efficiently make decisions regarding potential health problems, the National Association of County and City Health Officers, along with the Center for Disease Control, developed a flowchart that spells out how communities can improve health through strategic planning. When developing policies for healthcare, organizations such as the Office of Government Ethics must ensure that ethics are applied and enforced through much of the laws that have an impact on the nation's health. Ethical behavior in healthcare is of the utmost importance because it is unspoken. It is the unspoken rights and wrongs of the way physicians and administrators provide care to patients. Clinical ethics fails to recognize the effects of the organizational culture in which healthcare is delivered, which include the effects of the culture's informal rules, and more importantly, the effects of its beliefs and assumptions regarding ethical conduct and ethical decision-making. Stakeholders are the individuals that have a financial investment in the healthcare world. When developing policies, the stakeholders should be a part of the conversation. This way, they are fully aware of the practices they are choosing to support. It would not be a good idea for a medical facility to be involved in a malpractice suit that the stakeholder has their name on and are not aware of its ethical principles. The health organizational structure concludes as the assurance principle. This is the point in the process where we look at the entire process from beginning to end and make sure that everything is working as intended. For example, prenatal care is measured by the morbidity and mortality rates of infants. This is the MAP model. It's been effective for addressing a range of community health issues, such as improvement in overall health, increasing the quality of public health departments, and addressing the health needs of specific subgroups in the community. In public health, researchers focus on the well-being of communities, which creates new ethical dilemmas. Among the ethical issues commonly debated in public health are whether the infringement of individual liberties may be considered a morally legitimate cost of improving community health, and whether evidence-based approaches to care that may be culturally problematic should nonetheless be implemented. Although the parameters for the Affordable Care Act are still being ironed out, The biggest complaint so far is the interference by the government in the matters that are so personal as is insurance. Many people feel as though it should be their choice on whether or not they want to have health insurance. As far as public health is concerned, the ACA's mandate allows for everyone to receive preventative care, regardless of income restrictions. Preventative care is important when it comes to public health because it allows for diseases to be caught before they have a chance to spread. Medicare is the government-funded insurance provider to men and women aged 65 and older. After retirement age, it is harder to receive a good rate on health care. One of those reasons is no employment, and the other is the likelihood of pre-existing conditions due to age. Medicare has made it possible for the older generation to ensure the public and community health of individuals that are later in life and may have conditions that before the enactment of the ACA would not have been able to receive care for. Part A of Medicare covers hospitalization, nursing home, and hospice care. Part B covers prevention, screening, and medical supply services. Part C is both A and B together. When it comes to communication, it's vital that there is an effective emergency management organization. When natural disasters strike, such as the F5 tornado in Moore, Oklahoma, or Hurricane Katrina on the Gulf Coast, that cause catastrophic damage to large areas, there are processes and organizations in place to respond. Emergency management has 8 principles that it operates by to ensure ultimate success. Comprehension addresses the understanding of disasters to make sure preparation is appropriate. Progressive anticipates future disasters. These are the 8 principles. The first one is progressive. It anticipates future disasters and takes protective, preventive, and preparatory measures to build disaster-resistant or disaster-resilient communities. The second is risk-driven. It uses sound risk management principles in assigning priorities and resources. The third is integrated. It ensures unity of effort among all levels of government and all elements of a community. Next is collaborative. It creates and sustains broad and sincere relationships among individuals and organizations to encourage trust, advocate a team atmosphere, build consensus, and facilitate communication. And there's coordinated. It synchronizes the activities of all relevant stakeholders to achieve a common purpose. Flexible. It uses creative and innovative approaches in solving disaster challenges. Professional. Value a science and knowledge-based approach based on education, training, experience, and ethical practice, public stewardship, and continuous improvement. FEMA is the Federal Emergency Management Agency. We are most familiar with FEMA from Hurricane Katrina and Hurricane Sandy. This is the federal agency that responds and provides food, water, and monetary resources in the aftermath of a natural disaster. This agency also provides preparedness training to ensure that local and state agencies are ready to respond at a moment's notice and also to support their community in their time of need. In conclusion, we have gone over the many aspects of public and community health as it relates to the well-being of populations. So much goes into ensuring that we are aware of diseases that affect our population and that we know how to respond. Knowing what organizations control which area of the public health realm makes it easier to receive answers to the questions we may have. From the public health structure to the stakeholders and response teams, we learned that the importance of communication to make sure the process flows efficiently. Knowing where certain threats originate and how to categorize issues, respond to reports, and analyze contributing factors increases our chances of surviving the next outbreak.